I think you should start immediately and as early as possible in the process development stage. Very important is just to start simple. Focus on the low-hanging fruit. Don't aim for the most ambitious goal that you immediately want to have an online real-time connected digital twin, right? Because it can be very discouraging if you don't hit this ambitious goal, even if you made a lot of progress. Start simple, but at the same time, it's also important that you keep an eye and the goal in mind, that you make sure you're setting up the basics correctly. You collect the data which you need to later forecast actually the kind of variables you are interested in.
Welcome back to the Smart Biotech Scientist podcast. We are in the middle of an exciting discussion with Fabian Feidl, and we are diving into the revolutionary world of digital bioprocess development. We're about to explore how models are transforming the industry with our guest, Fabian Feidl. He's the co-founder and CTO of DataHow. We are talking about process models, getting from raw data to actionable insights, and the AI revolution. If you have not listened to part 1, please do so. And now, are you ready to decode the future of bioprocessing? Let's get started. Are you juggling the complexities of CMC development while trying to enjoy the beauty of biotech? Have you ever wondered if there's a way to simplify bioprocessing? Welcome to the Smart Biotech Scientist podcast, where we're diving headfirst into the very challenges you face. We're breaking it down, demystifying the jargon, and giving you the keys to unlock your full potential. I'm your host, David Brohlman, and I get it. With 15 plus years in the biotech industry, I face the same challenges you do. There's a way to simplify and streamline so you can remove complexity, you can skip trials and errors, deliver without delay your groundbreaking therapy to clinics and market, and still enjoy every single step. Do you want to learn how industry experts and I did it? Grab a cup of coffee and your favorite notebook and pen. Now is the time to take your bioprocessing game to the next level. Let's smarten up biotech. One of the hurdles is the mindset, and that certain decision makers don't see the benefit or the return on investment. So now my question is this: how can you, as someone who is convinced, like somebody who is, let's say one of our listeners who works in a company who is convinced and sees the benefit of these technologies and sees the ROI, how can they convince people who might be skeptical, and whether they are senior management or their other colleagues, how could they convince and actually show them, no, it's time to implement these technologies now rather than later?
That's an interesting question. So I would say they should start now, because this tool can really immensely improve the day-to-day work. They really help unlock valuable insights and offer a structured approach that not only aids in making those decisions, but also provides a solid backing for those decisions. You can go back and say, look, back at that time, our knowledge was that, captured by this version of the model. And plus, they make it easier to communicate the findings and ideas between the stakeholders. So think of a model-based tool as a vehicle for the knowledge. You can share what you've learned with your colleagues and seamlessly transfer that knowledge to the next process scale. It's like having a digital notebook that captures and carries the expertise, making collaboration and the scaling and the transfer to other sites or the process stages way smoother. However, to be frank, there are also some misconceptions. A big one is the idea that once you have a model or a digital twin, you don't need to perform any more experiments. And it is true that models can help us significantly reduce the number of experiments, and also with the help of transfer learning, it's mind-blowing the number of experiments we can basically save. But it will be not a complete replacement. So you still need to validate and refine the model through real-world data. And I think another common misunderstanding when we're talking about models, and very often kind of skeptical people mention this. See, it's not working. The model is bad, right? It cannot predict actually in this area. I told you it's not working. But then if we go into the details where the model isn't predicting well in this area, it's telling us something. So we need to learn or investigate further. Instead of dismissing the model, we should see this as an opportunity, improve the understanding in that direction again. And when we dig deeper, we usually see, look, the model just brutally honest tells you now you cannot know this because you haven't performed any experiment in this direction. And potentially your gut feeling tells you, I know what happens, but it is not actually shown, or the evidence is not basically formalized. Sometimes this can be brutally honest. And I think this is another misconception.
So what advice would you give a company that's still hesitant to invest in model-based approaches?
I think the process is like going to the gym and losing weight. We all know that going to the gym and exercise regularly are the first step to getting fitter. But the results only show after months of this. And I think it's exactly the same with digital process development. It requires an ongoing commitment and, of course, a systematic approach. And sometimes you also have kind of problems and you need to potentially go back. But the benefits might only become clear in the long run. I think the good news is that more digital natives step into this decision-making roles, what we also see recently, and they are more likely to accelerate the transformation in the industry because they're fully convinced on the long term. They understand if you're capable to leverage the data, the insights, manage and even reuse the knowledge, you really build a comprehensive knowledge base. And this provides you a huge advantage. And to go back to your question, you should rather start today than tomorrow, because over time, this will become a sustainable competitive edge even for your company. I think companies shouldn't risk to fall behind in this direction because it potentially misses out a critical momentum when the industry evolves in these digital tools.
Let's talk about an extremely hot topic now, large language models. How do you envision their role in the future of bioprocess development and manufacturing?
Oh, I have to admit, I'm a huge fan of generative AI. And even though it might be a bit overhyped right now, it's already changing a lot the daily business. So in DataHow, we are currently experimenting a lot and even have a prototype embedded in our product. Not yet released. We want to be careful on that. But we started with a retrieval augmented generation approach, where we essentially trained the LLM on our specific knowledge. So we used our product manuals, our publications, our webinars, and our DataHow Academy content. And I have to say, I'm really impressed with the results so far. And we've also taken it a step further and taught the large language model to use our software developer kit to really access DataHow Lab. And that's where things get really exciting. Potentially also a bit scary. So you can imagine now you can just type in a natural language query like, what's the final title of experiment X epsilon? Or please plot the viable cell density profile of runs where glucose level is under that level. And it's just incredible to think that you can generate a plot or analyze data by just asking a question in plain language. So operators doesn't need to be trained long on softwares and are guided actually through this workflow. Now, of course, you always need to be cautious about having hallucinations and always validate, but I think also the users are more and more understanding how to use large language models and interpret the outcomes. So I think it's just a catalyst. And for DataHow, to be frank, it will be a competitive edge. Everyone can do large language models, but in addition, we have our model engine. And if we can combine actually our model engine with large language model, this is things where it really gets excited. I can't say more about that right now, but I do see a huge change here in this direction, actually.
Wow, the future is bright, definitely. I would like to circle back now to your experience when you were working with the cancer patients, because I love that you started having a purpose. And what I wanted to talk about is now, how can we enable the next generation personalized medicine through these amazing development of technology? You mentioned your models, the conversions with large language models, with even more knowledge and new technologies that potentially tomorrow already will be at our disposal. Where do you see this going?
I think the big challenge with personalized medicine is really, instead of developing one process for millions of patients, we need to develop a unique process for one individual patient, ideally in a decentralized set, like within a hospital. But how do we ensure now consistent quality when we only have potentially one shot to get it right? We know how much process parameters can impact the outcomes or the selection of a cell clone, right? And you have many publications in this direction. On the other hand, we also knew that there is a huge variability between the different donors. We don't have the time or the resources to run multiple iterations or validate this. So it's really, really difficult. And there is just where I see enormous potential for applying transfer learning in a very systematic way. With each patient, we can gather more data and learn and transfer those learnings to the next therapeutic approach potentially. And over time, this could allow us to distribute production intelligence across different sites. That means the algorithm sits somewhere in the cloud, but really are in a kind of edge component hosted in the hospitals. And the idea just to leverage what we've learned from each case to continuously improve and adapt the process according to the needs of the patient, this is just mind-blowing for me. And maybe another personal note is I was once donating stem cells for a patient, actually, and I was sitting in the hospital where the stem cells were actually isolated from the bloodstream. And there I was just thinking, well, the cells are out, right? Why not genetically modify them on site in the hospital and just feed it potentially back to the patient? I think it's still a long way to go there, but I think it's the future, no? And this is just super exciting for me.
Wow, that's very fascinating. Now, if you're listening and you work for a small company and you think, well, this is great, I'd love to leverage the technologies, but you have limited resources. Let us talk about how you can get started. So, Fabian, how should a small company with limited resources get started today? And also the other question is actually, at what stage of the process development should you be starting with these digital technologies?
I think this is valid for smaller and larger companies. I think you should start immediately and as early as possible in the process development stage. Very important is just to start simple. Focus on the low-hanging fruit. Don't aim for the most ambitious goal that you immediately want to have an online real-time connected digital twin, right? Because it can be very discouraging if you don't hit this ambitious goal, even if you made a lot of progress. Start simple, but at the same time, it's also important that you keep an eye and the goal in mind, that you make sure you're setting up the basics correctly. You collect the data which you need to later forecast actually the kind of variables you are interested in, all right? But I think start simple and also accept the fact that it's a process. It is a lot of back and forth. It's not just about having the resources, actually. It's about commitment and I would say also agility, which is something smaller companies can actually be really good at, no? Start small, stay flexible, build up from there, and then you might even be able to move faster and adapt more easily than these larger companies or larger organizations.
From all we have covered today, Fabian, what is the most important takeaway you want our listeners to walk away with?
I hope I could at least convince some of the listeners that models in process development can be a very powerful tool. However, the tool shouldn't be seen as just some overly complex academic tools. They're meant to be practical and useful. A model should be actually only as complex as it needs to be, but not more than that. We need to make these tools accessible, easy to use for biotechnology scientists and not just data scientists. The complexity should be, as said, hidden behind a user-friendly interface, and the insights, the decisions should be actually directly connect and leading to action. And in data, we often compare it to weather forecasts. I don't care basically what's the model behind, right? I don't want to spend time on improving it. I don't want to call a meteorologist, but If that forecast helped me decide whether or not to plan my wedding inside or outside for the next day, that becomes invaluable. The same goes for models in process development. Only useful once there is a decision you got supported in. I hope that in the coming years also the workflows adopt to these tools and that using process models becomes as intuitive as checking the weather on an app.
Wow, thank you very much, Fabian, for sharing these invaluable insights. Where can people connect with you?
I'm on LinkedIn. You can connect with me via email. We usually have also DataHow events where we provide courses, but also symposiums. So I think this is another interesting field, how to get in contact with me, but also with DataHow and of course on conferences. I'm not that often on conferences because I'm more in the back office. I'm really, really looking forward to connect.
Yeah, smart biotech scientists, I will leave all the links in the show notes. Please make sure to reach out to Fabian. And once again, Fabian, thank you so much for being on the show today.
Thank you, David, again for the opportunity and following it on a regular basis. I wish you lots of success for even further expanding your audience.
Thank you so much. And that wraps up our deep dive into the world of digital bioprocess development with Fabian Feidl, who is the co-founder and CTO of DataHow. We have explored how models are revolutionizing biotech, from optimizing processes to enabling actionable insights from raw data, and the potential of large language models. Thank you so much for tuning in, and don't forget to leave a review on Apple Podcasts. It will mean the world to me. And perhaps you don't know where to start. As your fractional CTO, I'd love to help you identify the first low-hanging fruit so you can leverage the potential of digital process development right now. Just book a free call with me and I'll help you get started. So thank you very much for tuning in. Until next time, stay smart, biotech scientists. All right, smart scientists. That's all for today on the Smart Biotech Scientist podcast. Thank you for tuning in and joining us on your journey to bioprocess mastery. If you enjoyed this episode, please leave a review on Apple Podcasts or your favorite podcast platform. By doing so, we can empower more scientists like you. For additional bioprocessing tips, visit us at smartbiotechscientist.com. Stay tuned for more inspiring biotech insights in our next episode. Until then, let's continue to smarten up biotech.